Motor vehicle crashes or sports injuries are headline-grabbing types of trauma, but by far, the most common type of trauma seen at UW Health comes from a commonplace source: personal surroundings.
Each year, UW Health treats thousands of patients with injuries related to falls, and most falls occur inside the home and impact people older than 65. Dr. Ann O'Rourke is the medical director of the Level 1 Trauma Center at UW Health, joining us now. Thanks for being with us today.
My pleasure.
What is causing a lot of these falls at home?
It's really multifactorial. We think about the built environment, and so there are things about home that maybe aren't safe. Throw rugs that are loose or curled up at the edges. We're just coming out of mud season. All the shoes that we have stacked around our doorway, all of us. Not having the lights on at night when you get up to go to the bathroom. The bathroom itself not having grab bars or things that are slippery. So home can just be a place that we can actually make safer with some quick adjustments. And then as we age, oftentimes we're on more medications. Those can make you a little lightheaded when you stand up. Sometimes our medications need to be adjusted, and then our vision's not as good. You might need to have your eyeglasses prescription. I don't know about you all, but I'm in bifocals and I have trouble with my feet on the stairs just seeing through the bottom part of my glasses. Don't worry, I can still operate with my bifocals. I can still see close up. But so all of those kind of things are a combination that put our elderly patients at risk. And then of course, many of our elderly patients have osteoporosis, which means those low energy mechanisms like a fall can result in fractures that might not occur in someone who's younger with stronger bones.
What does it mean, Level 1 Trauma Center? Is that a fancy name for emergency room, urgent care, or?
That's a great question. So trauma is really a resource-intensive thing to provide because we are prepared to take care of someone who has fallen at home and broken a hip or some ribs, all the way up to someone who's been in a severe motor vehicle crash or who has been shot. And so not every hospital should have to provide that kind of resources. We need to concentrate those in things. And so a Level 1 Trauma Center is something that really has all the resources we could possibly bring to bear 24/7. And then throughout the state, we have other levels of trauma center which are prepared to stabilize you in the case of an emergency and then transfer you someplace that has sort of everything that we have. So a Level 1 center, it's not so much a place as it is a system, and we're prepared to take care of the spectrum of trauma from injury prevention, which is what I'm here to talk about today, all the way through rehab. So we meet many of our patients in the emergency department. They get admitted to the hospital. We have a special ward, our special ICU, which is called the Trauma and Life Support Center. And then, of course, if patients need it, they go on to rehab and super specialized care.
If you fall, you go to the emergency room, and you go through the system at that point.
That's right. That's where I meet a lot of my patients.
Okay, so how do we avoid meeting you in the emergency room?
Yeah, I mean, so those things I already talked about. A safe environment at home. There are services here in Dane County that you can ask your primary care provider. Can we have an occupational therapist come out to the house and do a home safety evaluation? Just really, I mean, throw rugs are beautiful, but if you're gonna slip and fall on them, it's just not worth it. Meet with your primary care provider. One of the things that we screen for is just the question, are you afraid of falling? If you're already feeling a little steady, tell your primary care provider that. They can go over your medications, maybe get your eyes checked, and then there are actually classes you can take to help get your strength and balance better than it is. Falls are absolutely something that can be prevented. It's not a natural part of aging. And everyone wants to keep their independence and to age at home. Right?
And I imagine some people might be a little bit embarrassed to talk about it too.
Absolutely, and so if you know someone that you love, if you notice maybe they're a little more unsteady on their feet.
Watch the people in your house.
Exactly. You know, just bring it up. I mean, it's frankly an easier conversation than maybe talking about driver's licenses or other really hot topics. But I mean, I really try to frame it as maintaining independence for as long as possible, and I think that's what people are really scared of. And of course, if you are severely injured, of course, many times you're in the hospital for a while, you're going to need some extra rehab and maybe never get back to your baseline as far as level of function.
So let's not even go there.
That's right. That's right.
Great information, doctor. Thanks for being with us today.
My pleasure. Thanks for having me on.